Hello. Oh, yes. Thank you for pointing it out. Okay. So, nursing program is exciting for us all, as it is exciting for you. Okay, you're excited to, start on a new journey, a journey of life, because after today or after this week or after a few years, um, you will be, you know, completely submersed in your profession, and professional training, you know um, it changes you as a person. Okay, professional training makes you a different person. Okay, there's a you when up to the grade like 12 or 13, you learn things. Okay, you learn norms of the society. Okay, but when you go into a profession, there's a process called re-socialization. Okay, there's a process called re-socialization where you learn something new. It's a society, any profession for that matter. Any profession is a society within a society. Okay, so you live in a society, we all live in a society, but and society has a culture. Okay, society has values, society has traditions, things that you must do, things that you should do, things that that you can't say, or you can say, or you must say. Okay, things like that. That's called culture, that's called values. But then there are subcultures. Okay, within that culture there are subcultures, within that society there are sub societies. Okay, so nursing, medicine in general, or even if you're going to be a police officer, or in going into any specialized profession, there's a subculture that changes you as a person. Okay, so after like few years, you might not know, but you're a different person. Okay, other people will recognize, they will see you, that okay, you have changed, you're more groomed, you're more manner, you know more things about your culture, and you know more terminologies, you know what you should do as a nurse, as what you should not do. And it's exciting, it's all good, there's nothing wrong with it. And that's what I'm saying, that this is a journey of life. Because once you go into a professional college and you start studying and start getting exposed to that environment and people who are excited, who are not making you feel depressed, or giving you boring lectures, or making you sleep at the back benches, everyone, not those people. um, Probably people like me, boring in a way that I don't know much spoken Arabic. Okay, so if I have to explain anything, I still have to explain in English, and sometimes it might be a difficulty in communication, I know this. uh, and when other people, like the vice president or the dean, uh, when they are speaking in Arabic with the students, and you see me smiling like this, that means I don't understand what they are saying. It's not like, okay, I know Tayyab, um, and yeah, please come. Nursing? Yeah, yeah, please come. So when you see me like like you know just nodding my head, saying nothing. Okay, if I understand, I will say something. If I don't understand, I will just maafi mushkila. Okay, a little bit of stuff, here and there. So you might have some difficulties. Okay, I apologize in advance. um, I will try to learn some of the Arabic, so that I can communicate with you people, and with other students from College of Medicine. But I don't know how good I am at, with age, the learning potential decreases. Okay, your brain is not that much neuroplastic. You are neuroplastic. Your brain is adaptive. You learn very soon. You can learn new languages. You can learn new professions, new things. You can memorize them. But like for me, it's a little bit difficult. So my name is Dr. I. Khalid. I'm assistant professor of physiology in College of Medicine and Health Sciences. Okay, it was not health sciences before. Before it was College of Medicine and Medical Sciences. But with you people, to accommodate you and to welcome you, we changed the name of the college altogether. So you see how excited we are about about having you here. Anyways, so it's like College of Medicine and Health Sciences. My office is on second floor. The room number is 220. Okay, 020. This is the floor number, and this is the office number. Please come. And my telephone extension is 767, and is my email also. So you can reach me if you have any difficulties. You can email me. You can come to my office if you want to know about anything. Um, you're always welcome. Okay. There are some specific hours. We'll get to know each other more. At what time I have other commitments, other teaching commitments, or medical students teaching or stuff. But then we will have time that okay, you can come at this time on this day if you have any particular questions. Otherwise, sitting here, you can ask questions. You can interrupt me. Like in university, we take people as self-motivated. Okay, you are self-motivated. We are not forcing anything on you. Okay, if you want to, if you are not feeling good, you can walk out. You don't have to ask for my permission. Like you're in a school, you're not in a school, you're in a university. Okay, if you have to attend a call which is really serious, you can just go out, attend your call, phone, and then come back and join me. At least for me, it's okay. If for other professors, I don't know. So just be careful with other people. Some people don't like it. Okay, but for me, like there's no problem. As long as you're self-motivated, you're happy, you're listening, you're awake, you're welcome. If you're not feeling good or you're not liking the thing, you're boring, you feel bored, and you're not, you have anything more important to do, you can walk. Okay? Okay? Excited? Let's begin. Okay. So physiology is, yes. I was looking for some quotations to motivate you, and then for nursing, Jane Watson is an American nursing theorist and a nursing professor. And I wanted to actually mention this, that nursing is such an exciting career. It's on one way it's the people who spend most of the time with the patients, with the sick people, sick mankind. Okay, be it's a woman, it's a child, or it's an old person, or whosoever it is. Okay, so doctors will come, they will see, surgeons will come, they will operate, physicians will come, they will have a round of the unit, and they will pass orders, and then they will go. Okay, but it's the nurses who spend most of their time with their patients. They're their patients. Okay, so first of all, huge respect for nurses. Okay, all over the world, it's a very, very noble profession. And then the passion that lies behind selecting that profession and being in that profession is much more than anything else, because then you are in direct contact, you're caring for the sick. Okay, like it's more than doctors. That's what I want to tell you. And if I have at the life, and and then I have to choose again, maybe I will again go into teaching like this, or a bit of research. But after, like, nursing would be one of my top priorities. I didn't know about it much back in time when I was doing my university. So after nursing, like Jane Watson, you can become a full-time nurse, a professional nurse, or you can go into research, you can do masters, you can do PhDs, you can become a nursing professor or nurse scientist. Okay, there's something called a scientist. And in medical profession, if there are doctors who are practicing doctors and they want to do research and they want to do things like other stuff, we are really running out of time. So they are called physician scientists. Okay, a person who has got an MD and also a PhD, and they are doing research and also seeing patients. They are called physician scientists. So if there's a nurse who has gone into research and academia and teaching and that, so that would be a research or a nurse scientist, okay, nursing professor. Okay, so you can do anything, you can be anything. You like stem cells with pluripotent stem cells, you can be anything in nursing. Not like me, because I'm already differentiated cell that goes into one of the things. I hope you know about things like that. Mother Teresa emphasized on doing things with with lots of putting love into it. So in any profession, if you put enough energy or enough enough of yourself into it, if you invest yourself into it, then that profession becomes good. Okay, it's good. Whatever you're doing, just be happy to do it. Be happy and invest yourself. And then with this particular profession, when you are in a um, in caring for the sick people, it's sometimes it's stressful also. For doctors, it's also stressful. Okay, doctors go through difficult times because they absorb stress from their patients, okay, who are sick, who are not feeling well. Nurses, they also go through difficult time because they absorb that negative energy or despair or sickness from their patients. Okay, so be ready for that. And it's exciting, but at the same time, you have to be, motivated enough to absorb that negative energy or caring for the sick and the difficulties associated with it. Not scaring you, just making you excited about it. So when we start doing things, we talk about anatomy and we talk about physiology. Okay, so that's how we begin. We talk about, and it's like an Apple event. Apple event. They open up an iPhone 16 Pro Max Plus, whatever, and they start telling about its hardware features. That's its anatomy, and then they start selling it like it's a camera function is this and this and this, and then they talk about physiology. But since physiology is like, I find it more exciting in a way that you're talking about some miraculous things that happen, like the function of when we are talking about AI and when we're talking about the camera that the iPhone 16 has and how many megapixels and sharpness and blah blah blah. We actually feel very impressed, but the camera that you have, that I have in our eyes or our sensory organs, they are much more complex and they are much more exciting to study. Okay, so it's like an Apple event but about human body. Okay, I'm not selling anything. Okay, I'm just trying to explain how excellent and how immaculately and how fascinating human body is. And like for me, physiology is good because I don't have to talk about any diseases. Oh, not like most of them, but just few of them. Okay, but usually physiology is about how things function normally. Okay, physiology is normally functioning. Okay, like how the heart beats and how cardiovascular system and blah blah blah. So normal things, we'll talk about only normal things. Other people will come and they will tell you about scary disorders and diseases and stuff. So we are in a happy zone where we will admire human body function and we will feel fascinated and curious about learning new things and stuff like that. So that's our job. Okay, physiology. I have this. Yeah. Okay. So human physiology is how things work. Okay. Now, when we start talking about it, it's like how a body works and how its systems work, how its organs work, how this at the cellular level, what happens at cellular level, and then the effect of disease on those functions, normal functions. So that's called the pathophysiology. That's called the abnormalities that occur. Okay, you with me, or you sleeping? No sleeping? Okay. So a patient may come to you with some symptoms. Okay, they say, okay, I have pain. That's called symptom. Okay, and then you have to look for some signs of where's the pain's coming from. You have to ask some questions, and that's how you need to get to the disease of that person. Okay, or address that person, for example, address that symptom or and the signs and the disease. And for that you need to know the knowledge of form and function. That's why you need to know the anatomy. That's why you need to know physiology, and it's in small pieces every day. Okay, every day. It doesn't look very relevant to what you will be doing as a nurse, but trust me, when you're on the bedside of the patient, you will remember all this. It all comes together, like what you learn in 4 years. It all comes together eventually. So to study that, we have different levels of organization. Okay, this picture is from the book which is recommended, the Pearson Anatomy and Physiology for Nursing. I hope you all have it, or it's soft copy or hard copy. So level of organization is, as you know, a human person, or for example any organism, is made up of, like, it's more easy to go reverse. It made up of organs. Organs are made up of, tissues. Tissues are made up of cells. Cells, they are made up of molecules, and molecules are made up of atoms. Okay, so we divide those levels of organization. We study different levels of organization um, to make it easy, okay, to understand each and every tissue, each and every cell, each and every system, and then we bring it together to study the organism, the eventual organism level. Like, if you see, for example, I don't know, it's from the previous generation, but Roberto Carlos was a Brazilian footballer, and one of his, goals, a very famous free kick where the ball was turning like this and going into goal, and everybody was stunned. So the thing is, a footballer, for example, thinks about something. Okay, they have in mind. Okay, their eyes are looking at the ball. Ball is coming, the way it's spinning, the air traffic, the direction of the air, and whatever they are facing, everything is being processed in their brain. Okay, everything is being processed, and then they adjust them accordingly, and they perform a kick, or they throw it, or head, or whatever they do. Okay, so that's where all the systems are coming: the eyes, the ears, the sensory organs, the muscles, the what are they're listening from other people. They all systems are telling them to kick or move their foot in a particular way, and that occurs. The output is there. Okay, so that's how all the systems, they integrate into one function. So atoms, molecules, and then cells are the smallest living units, and cells make tissues. Tissue is a group of cells that work together, usually similar. Okay, like nervous tissue or muscular tissue, smooth muscle, skeletal muscle. They're usually cells of the similar type, and they work together. Okay, they're working with each other to perform a particular function, and different tissues make an organ. Okay, like, for example, you can say liver is an organ, or stomach is an organ, and they are made up of different tissues: the secretory cells, the smooth muscles, the blood vessels, everything. So different tissues, they make one organ. And from organ, we go on to organ system, which is organ system is made up of interacting organs. Humans have 11 systems, so we'll talk about it. And that organ system, they come together to make one organism, or one individual. Okay, so that's how things. So we'll go quickly. We have time from 8:30 to 9:20. Okay, so we have some time. Okay, so far, any questions? No? Am I speaking too fast, or too slow, or too loud, or too? It's good? It's okay? Back at the back, people? Are you listening? Okay, great. This lecture hall is not exactly made for lecture hall. The back seats are not up, so if you're having any difficulty looking at the screen, you want to adjust your seats or something like that. I don't know how to help, but the lecture halls on the other side, they are more, the people at the back are sitting at a different level, so they can see the screen. So all of you can see the screen? Yeah, okay, great, thank you. So going into the organ systems, we have like 11 systems: skin, skeletal muscle, muscular nervous system, endocrine. We'll have a look at the some of the systems. Okay, for example, one of the important systems, and again, dividing into systems does not mean that these things work individually. Okay, the systems cannot work individually. They collaborate with other systems to work. Okay. But for our ease of study, for our own understanding, and to make it do something in a 50 minutes lecture session, we have to divide into smaller bits and pieces. Okay, so that's why we study system, or we divide into systems. So, for example, skin or in integumentary system, we will go into sufficient details that you need to know. Its major parts are skin, hair, sweat glands, and nails. and it protects you against environmental hazards. Okay, it's a barrier between you and the environment, your skin. Okay, and so anything that comes in contact with you, it comes in contact with your skin, and then usually your skin protects against it. Or sometimes if there is any breach in your skin, for example, you have a wound, so that's where you can get an infection, or something can enter your skin, and they can harm you. So your skin protects you against environmental hazards, be it microorganisms, be it, for example, any macroorganism, or any chemicals, or things like that. So your skin protects the internal organs and systems again, from hazards of environment. And it also helps regulate body temperature, because your skin is something exposed to environment, so it's continuously gauging the temperature from the environment. Okay, if you're feeling cold, your skin reacts in a way that or if you're feeling hot, your skin reacts in a different way. So if you're feeling hot, the blood vessels in your skin, they dilate, and you sweat, and that sweat makes you feel cool. Okay, losing that temperature. And if you're feeling cold, then the peripheral skin blood vessels, they are constricted, and there are other systems that come into play to make the temperature go up again. Okay, sensory information. For example, something is hot, something is cold, something is um, um, what kind of texture things have, what kind of feel things have, or even working in relation with the eyes and with the ears. You can see something, and you can feel it already, that okay, it's giving this kind of information. So skin has got these functions. Then you have skeletal muscles. Skeleton is something that holds you upright, that supports your weight, that makes you protection from other tissues. You can bear weight on it, and then it produces the bones, the skeleton. It's a production house for blood cells. Okay, there's inside the bones, there is bone marrow. Bone marrow has got so many things to do, and it stores calciums and other minerals, and it includes bones, cartilages, ligaments, and bone marrow. Okay. The muscular system is the skeletal muscles and associated tendons. Now, bones cannot move. Okay, you have to have muscles to move the bones, or to make any movement, or any purposeful movements. Otherwise, your bones will just stay there. So they provide skeletal muscles. They provide movement. They provide protection and support for other tissues, and generate heat that maintains body temperature by when you're feeling cold and you're shivering, your body is in a state of shivering. That's the skeletal muscles making that movement to produce some energy for your body. Okay, so the skeletal muscles, they work also, again, working in collaboration with skin, and in collaboration with the higher centers in the brain that regulate the temperature, stuff like that. Then the nervous system. The nervous system is particularly, maybe I talk more about it in future, because this is my own area of interest, my own area of research. So nervous system is more fascinating than any other part of any other system in the body, because it's more complicated. It functions more in a very, very high degree of complexity. There are billions of neurons in your body, and they function all together to maintain a level of functionality in your body, which is very, very fascinating. And it has got so many functions. We can talk hours and hours about brain, and physiology is filled with it. And at the end of this session, we have this, like this semester, we will talk about the nervous system also. So I'm hoping to have some interesting lectures coming up next. So it functions it immediate response to stimulus. For example, now if you're feeling cold, if you're feeling hot, or if you see a predator, for example, in your environment, you're going from in a place where you're alone, and you suddenly you see a predator. Now all you see is the visual stimulus that goes into your brain, and your brain processes that stimulus, and then it gives you a response of fight or flight. Okay, either that predator is good enough that you can fight it, or you should try to run away. Okay, and it happens in minutes, in seconds, in fractions of seconds, and then it coordinates or moderate other organ systems. For example, blood pressure. When you are lying down, your blood pressure is different, and when you suddenly stand up, in a fraction of a second, your blood pressure is maintained according to your posture. Okay, fraction of a second, and if there's anything interfering with that function, then it would lead to a drop in blood pressure. Okay, blood pressure will drop, and there are some people who, when they stand up, they feel dizzy. Okay, their system is not working, so that's where nervous system is working in coordination with the blood pressure system to maintain it. And then it provides and interprets sensory information. That's what I was saying, that if you see something, if you hear something, it interprets it into to make a suitable response. For example, speech is one of the very interesting thing. Maybe we'll talk about it, but speech is something that if you uh, when you hear someone speaking, okay, when I'm speaking and you're hearing, there's a particular brain area which is reserved for receiving that stimulus. Okay, and then that area processes information, it sends to another area which is for speech production. Okay, so that area, so you listen to the speech, the other person who's talking and talking, and it was like you're only listening. But trust me, that's how it works. It should be both ways. I should be talking, and then you should be talking. But you can talk in your exams also. Then you will need to talk. So it processes that information, the speech comprehension area. Okay, comprehension. Word comprehension. Yeah. So there's a speech comprehension area. It comprehends that speech. It understands what is being said. It processes that information. It sends that information to speech production area. Speech production area gives an appropriate response. Okay, produces speech. Okay, involves skeletal muscles and everything, and all the memories and emotions and whatever is involved in speech comprehension and production. But that's how brain works. It interprets information, and then it gives and it tailors a suitable response. Okay, it tailors a suitable response to that stimulus, so that the bigger function is fulfilled. Bigger function we'll talk about. Then the endocrine system. Now endocrine system is the endocrine glands. They are all over in the body. For example, there's a pituitary in the brain, thyroid in your neck, adrenal glands on the kidneys, pancreas and gonads, and endocrine tissues in other systems. So their function is that, for example, this one thing is an immediate response to something. Okay, but then there's another thing which is a long-term response. Okay, so a hormone is released from an endocrine system that leads to long-term function. It's slower than nervous system, but it's long-term. For example, growth hormone is released for a long time when you're growing up. Okay, when you're becoming tall or big or growing. Then it adjusts metabolic activity and energy use. For example, insulin is a hormone, and pancreas is an endocrine organ, and it controls many structural and functional changes during development, like when you're growing up. So endocrine system is again one of the major systems. Then cardiovascular is most important and critical from this point of view, that as a clinical oriented person, you get so many patients who are in a critical phase when their cardiovascular system is not working. Okay, cardiovascular system consists of heart, blood and blood vessels. Okay, Blood vessels are coronary vessels on the blood on the heart itself. When they are not providing enough blood, there is heart attack of the patient suffers a heart attack. Okay, that's critical. When they are not working in the brain, then the person suffers stroke. When it does not work in intestine or any peripheral, the person suffers ischemia. So this organ system, cardiovascular, is the critical one, the most important one, which needs immediate attention whenever there is a trouble. Okay, and then you have your ECGs, and you have chest X-rays, and now the Doppler ultrasound, and so much stuff to deal with when you're having a patient of cardiovascular. So also distributes heat to control body temperature. Okay, like I was saying, when you're feeling hot, the blood vessels in the skin, they dilate and they dissipate heat, and when you're feeling cold, they constrict. Okay, so blood vessels, cardiovascular system working in collaboration with the integumentary system to maintain temperature. Then it also carries hormones from one place to other. Okay, with the hormones released by pituitary, they move to other places in the body via blood. Okay, the blood is the carrier. Also it carries oxygen, also it carries carbon dioxide, also it carries drugs, what you're eating, the medication that you take, or inflammation, and everything. Very, very interesting stuff. Then lymphatics. Now, whenever a person is having sore throat or having an infection, the doctors, they always like to ask, so are there any lymph nodes? Okay, so as students are always, they are told how to palpate lymph nodes and stuff. So lymph nodes, they are the part of the system which is the lymphatic system. It defends against infection and disease and return tissue fluids to bloodstream. The stuff is like the blood is coming. Okay, arteries are taking blood to your peripheral legs, for example, and the veins are taking it back. But then there is some form of fluid which remains in those tissues. Okay, in the muscles. Okay, when from one artery to capillaries and to cellular level, blood goes. Okay, and then it's collected by venous capillaries and goes into veins. Okay, but not all of it. Okay, there's some of that fluid, some of that thing that remains in the cells, and that is collected by lymphatics. Lymphatics is parallel to veins. Okay, they collect return tissue fluids to bloodstream, and these lymphatics, they are, if they are damaged, then the legs they swell and they become like elephant legs. There are problems, some toxins, some flies, some snakes, or some sort of poisons. They block lymphatics and leads to many problems. So lymphatics, they return things to bloodstream, and then it passes through lymph nodes. Now, for example, here is an infection, or here you're injured in this area. Okay, something hit you. Okay, and then so here the inflammation. Okay, the chemicals that tell you about inflammation, they are going back and they are going through inguinal lymph nodes. The inguinal lymph nodes will see there is some abnormality. They will try to react to that. Okay, and in that process, they will become enlarged and they will become tender. Okay, tender means when you touch them, you feel pain. Okay, so that's how lymphatics work. They're enlarged and they give you an idea about there's some sort of infection. So there are tonsils, lymph nodes, lymphatic vessels, thymus, spleen. These are the major organs, and then the functions. Respiratory. The major organs: nasal cavities, sinuses, larynx, trachea, bronchi, lungs, alveoli. Function, most important function is to deliver, is to take oxygen from the air you're breathing in, and then sending back the highly deoxygenated air. Getting the carbon dioxide out of the blood and throwing it out through expiration, inspiration and expiration. The gas exchanges, okay, gas exchanges, they occur in lungs. In the smaller part, it's called alveoli. Like the capillaries of blood vessels, there are alveoli of lungs. They provide. So lungs, respiratory system, it's a mechanism to provide oxygen to bloodstream and take out the carbon dioxide. it removes carbon dioxide and produces sounds for communication. So all these organs, they have some additional additional function as well. They help in speech production, and they have some secretory functions. They have some purification purposes. They have cosmetic functions. So lots of stuff. Digestive. We cannot do anything without digestive system. We cannot, live a healthy life without digestive system, because it processes and digests food. Okay, so it starts when you eat something, you chew it, you have saliva, you mix, you have enzymes, and then you swallow it. The swallowing mechanism, it goes into stomach. The acid production, the stuff that goes on in the stomach, then it goes in the intestine to for absorption, and the secretions come from pancreas and liver, and then gallbladder and everything, and then those absorption of all the nutrients that goes into your bloodstream, and that's how you harvest those things. And then it absorbs nutrients or water absorption, very significant, because otherwise, like, water won't be you won't be hydrated. And it stores energy. For example, you eat something, and at that particular point of time you are not doing any exercise, so the body will store that food for future use. Okay, so in liver, or it convert into fat, or other things. So the major organs are teeth, tongue, pharynx, esophagus, stomach, small intestine, large intestine, liver, gallbladder, pancreas, and other smaller stuff. Urinary system. Now, when you eat something, you have to excrete also. Okay, so one way is that you excrete it from you produce carbon dioxide in your metabolism, and you take it out through respiratory system. Okay, and the other is the stuff that you produce, the waste product. They are from blood. So the blood goes into kidneys, and through kidneys are a filter. So there the blood filters all the waste products. They go into ureter, and then urinary bladder, and thrown out from urethra. So it controls water balance by regulating volume of urine processed. Okay, so kidneys, they function how much hydrated you are, how much is the environment suitable. So in a hot environment, when we are losing so much water from perspiration or sweating or not drinking, so your urine will be concentrated and yellow. Okay, but in a cold environment, when you don't have any problem and you are sufficiently hydrated, your urine would be more diluted, more water in the same amount. Also stores urine, so that you can have a suitable place to go out, and then regulates blood ion concentrations and pH, one of the most important things that it does. Also, kidneys have other functions as well, like they produce erythropoietin, and they have some hormonal stuff, but that going into detail. Now we are just having an overview of the systems. And then the reproductive systems, male reproductive, it produces male sex cells and seminal fluids and hormones, and it includes testes, epididymis, all the structures that help in delivering that male sex cells, and then also they work in conjunction or collaboration with the urinary system. And female reproductive has got more variety of functions. They have ovaries, uterine tubes, uterus where the baby lives, and then other stuff. It produces female sex cells and supports developing embryo from conception to delivery, and then provides milk to nourish the newborn. I was saying before that they all function together for the bigger purpose. Okay, now what's the bigger purpose? The bigger purpose is to maintain a stable environment. Okay, maintain a stable internal environment for the body to survive. Okay, so that's like skin is working, cardiovascular system is working, urinary system is working, respiratory, nervous system, GI, reproductive system, everything is working to do one thing. Okay, and that one thing is to maintain a stable internal environment. Okay, that's called homeostasis. Okay, all body systems, they work together to maintain this homeostasis. And as medical professionals, it's our job to help a person maintain their homeostasis in an environment where they can function properly. Okay, so we work in a hospital. A person outside on the street, a resource, a person who is productive for the society. Okay, they are feeling unwell, they're not being able to work on a similar way for the society, they come to hospital. Okay, and we maintain their homeostasis, and they go back and they work back in their most appropriate way. So what is homeostasis? Homeostasis is the regulation of those functions. Okay, so there is one is the auto-regulation, and the other is the extrinsic regulation. Auto-regulation is something that works by itself automatically, and the extrinsic regulation is the responses controlled by nervous and endocrine system. For example, one thing is drinking water for maintaining body fluid balance. Okay, so that's extrinsic. But the intrinsic are the vascular dilatation or constriction to conserve water, or the work of the kidney, or things like that. So that's the balance. You're impressed with this beautiful picture? I found it very relevant to this. So homeostasis again is a complicated thing, but complicated in a way that there's a stimulus that comes, it produces a change in variable, a receptor, an organ that receives that stimulus, that processes that information and sends to control center, and control center sends it to effector, and effector responds in a way to bring that imbalance back to balance. Okay, so that's how homeostasis works. For example, this is the variable, it created imbalance, it sends a stimulus goes to control center and effector and brings it back. Now it's very similar to maintaining temperature of your room. Okay, thermoregulation in your room. For example, you have a stimulus here, the homeostasis is disturbed by increasing room temperature. There's the stimulus, the thermometer receives that stimulus, goes to control center sends to effector is the air conditioner, it starts working, and it brings the temperature back to the same place. And that's how, your set point is 22, and the temperature keeps varying even when you're sleeping, the thermostat is working fine. Okay, so and in the similar way, the body temperature. Okay, so body temperature is increased by increased, it sends a temperature signal, the information goes to thermoregulatory center in brain. Thermo means temperature, regulatory means regulating center in the brain, like thalamus, hypothalamus, that sends information to effectors, the blood vessels and sweat glands in the skin that we talked about. They produce increased blood flow to skin and increased sweating, and that loses that extra heat, and the temperature is restored back to normal. And if it's disturbed by decreasing, then the receptor will be the same, but it will send signals to the thermoregulatory center, and the signal will be sent to effectors, which are the skeletal muscles also. Okay, the blood vessels will be constricted, sweat glands will not produce sweat, and skeletal muscle will start shivering. That will create energy, decrease sweating, decrease blood flow to skin, and shivering. That will restore, or theoretically at least. Okay, not in every condition, but at least when you're go out in winter, like not the winter of Bahrain, but winter of in a cold country, so you start shivering, and that maintains your homeostasis. Okay, so that's how your temperature is goes around a set point. Okay, so for this purpose, there are some systems that work. Okay, and to go into detail, there's very interesting positive feedback, which looks positive, but it's very dangerous. Okay, and a negative feedback, which is probably the only negative thing which is good in your body. Okay, otherwise negativity is not good, apart from negative feedback system. So positive feedback is that there's an initial stimulus, produces a response that amplifies the stimulus. Okay, that amplifies the stimulus. It goes back and increases the same stimulus, and it's a feedback loop. Okay, a stimulus goes into loop, and it increases the stimulus. Negative feedback is the response of the effector that negates the stimulus. Okay, how does it work? For example, here's the thing: temperature of the room. Okay, set point, it's altered. Signal goes to the heater. Heat produces it, response, and when heat is produced, those signals are inhibited. Okay, the signals are not going to the effector organ continuously, so it's regulated. So that's negative feedback. If positive feedback is something which is, okay, this example is not very relevant, but this is relevant. Okay, so you have damaged a blood vessel. Okay, their chemicals start a chain reaction by clotting and cell fragments, insoluble proteins, they release more chemicals that further accelerate the process, and that's how, you know, blood clot starts forming. Okay, there's an injured cell, it releases chemicals. Okay, it releases toxins, it releases chemicals that regulate other cells. Okay, now it goes into the immune cells. The immune cells, they release more toxins. They think that, okay, there's some problem going on, so let's recruit more cells. They send more signals. The more signals go to more cells, and they release more signals. Okay, so that's the positive feedback. But after the blood clot is formed, there has to be a negative feedback to bring it back to normal. Otherwise, it will, you know, just lead to increase. Yeah. Yeah, I can, of course I can. So positive feedback is the initial stimulus that goes, that produces a response, and response comes back and increases the strength of the stimulus. Okay, feedback means go and feed the previous thing. Okay, so positive feedback means stimulus produces a response makes the stimulus even more stronger. It produces more response makes it even more stronger. It's a vicious cycle. Okay, very bad thing. Negative feedback is you produce the stimulus produces a response inhibits the stimulus. Okay, response decreases the strength of the stimulus because the response says, okay, I have, you know, taken care of the stuff, you don't need to worry now. Okay, so it will go into a negative feedback which will protect the internal environment. You understand? So the homeostasis is a state of equilibrium where the negative feedback and positive feedback, they are working all the time, virtually all the time. Okay, your blood is going at a very high speed in your vessels all the time. The blood vessels inside, they have small tears. There's coagulation. There are pro coagulation factors in the blood, anticoagulation factors in the blood. Okay? Everything is present there, and it's a state of equilibrium. Okay, like if there is anything, you know, it goes into makes a clot or dissolves a clot, or working in a positive negative feedback, they're working dynamically all the time. You know, problems are coming all the time, and the issues are being solved all the time. Now, what happens is that when they are not working effectively, or there's a problem with something, it results in a disease. Okay, now there's a very good example of this. Okay, so these are the examples. For example, blood temperature, osmoregulation is the osmolarity regulation, the water intake, gas exchanges, blood glucose, pH, blood pressure, hormone levels, metabolism, everything has got that dynamic equilibrium. And one of the examples that I put here is the blood sugar levels. It's just the, you know, almost last slide. So when you eat food, okay, so this is homeostasis, normal glucose levels, about 90 milligram to 100 per 100 ml. Okay, that's normal person. Now, when you eat food, there's a rising blood glucose level after eating a carbohydrate-rich meal. Okay, you can talk about it. What should you eat, and blah blah blah. My favorite topic, intermittent fasting, and glucagon, and okay, we'll talk about it. We'll have some time. Then the blood glucose level goes high. Okay, so the more carbohydrates, the more glucose absorbed in blood from intestine, the blood glucose level goes high. Now the beta cell of pancreas, they are stimulated to release insulin into the blood. Okay, insulin is the thing that stimulates cells to take blood inside the cell from the blood. Okay, something that is in blood is not inside the cell, it's outside the cell. Okay, so insulin brings it into the cells. Now when it brings into the cell, blood glucose level declines. Okay, it declines to a set point, and that stimulus for release of insulin goes down. Okay, so it the homeostasis is maintained at is around 90 degree. Okay, also it, from other cells it also sends it to liver to store as a glycogen, but it's okay. Now no, the other side of the cycle is that you're not eating, you're intermittent fasting, you're a like 45 50 years old person whose parents are diabetic and who does not want to be diabetic that early, so they are fasting for like 16 hours every day. So your sugar level goes down, declining in blood glucose level after skipping a meal. For example, breakfast is one of the most I should stop talking about it. Okay, later. uh, so the blood glucose level goes down after skipping a meal. Now alpha cells of pancreas stimulated to release glucagon, that's another thing opposite of insulin. It goes to liver to break down the glycogen that we had stored earlier when our glucose level was high, and that releases that glucose into the blood. Okay, to maintain that blood glucose level to a set point, and then the stimulus for glucagon release is diminished. Okay, so that's how dynamic it is. That's how you all during the day you don't even know what you're doing to your systems. Your systems are working automatically. That's why it's so fascinating. Okay, that's why it's so inspiring to study human physiology, because you're studying a machine which has, there's no comparison. Even like ChatGPT 4 is very nice, and maybe 5 is even better. But still, physiology is amazing. You will love it. So regulation, okay, the bigger purpose is homeostasis. All the system work together, and as medical professionals, we just have to maintain homeostasis. Okay, that's for your lesson for your life. Okay, just maintain homeostasis, everything will be fine, inshallah. Thank you so much for your patient listening. If you have any questions, always welcome. Okay, thank you. You're welcome. Welcome.
I have a question about the positive and negative feedback.
Yeah, yeah.
The
How you?
positive feedback is continuously